Hello, and welcome to another episode of the Med School Minutes podcast, where we discuss what it takes to attend and successfully complete a medical program. This show is brought to you by St. James School of Medicine. Here is your host, Kaushik Gua.
Hello and welcome back to another episode of Med School Minutes. Today we talk to Joe Torres. Joe Torres is our clinical manager. He has a very, very interesting role where he interfaces with both the education side as well as the administrative side of the clinicals to create a very holistic and well-rounded experience for the students, and also gives us feedback so that the school can better interact with hospitals and maintain the requisite relationships. So without further ado, let's welcome Mr. Joe Torres. Welcome to the show, Joe. Why don't you give us a little bit of a background about what you actually do at St. James?
You know, Kaushik, I'm still trying to figure that out after all this time. I've been working with St. James for 10 years, and most of that has been with the clinical department, working with our third and fourth year students, supporting them from point A to point Z all the way up to graduation. We do a lot in terms of the administration, providing student support with their schedules, allocating their itineraries with the different hospitals, making sure documents get shuffled from site to site. It's a lot, but in the end, our main goal is to get them to graduation, right? So that's a big part of what we do. Me specifically, I've been working with our administration and collaborating, expanding our footprint with the hospitals, acquiring new hospital relationships. And a lot of that does come from students who have connections. So we try to piggyback off of that and, support them in those endeavors.
All right. So my view of your role is that I think it's a very unique role, because I don't think anybody else actually has the view that you have, which is you actually interact on a day-to-day basis with individual educators from the clinical side, as well as the admin. So for example, in my role, I don't necessarily get to meet the individual educators because I don't necessarily need to, or unless I truly make an effort to. But you, in your current role, pretty much on a daily basis, you're dealing with, say, the CMOs and the DIOs of these hospitals, as well as the preceptors who are actually handholding the students along their rotation. Is that right?
Yeah, certainly the preceptors for sure. We see them not only during our site visits, which are pretty frequent, but we also see their evaluations of students. Okay. We see their commentary, we see their feedback, and that helps us learn a lot about what they expect from our students, which in turn helps me and my team set up our students for what will work in each rotation, right? So if Dr. Mizuno expects students to come in early and to round and to, prep patients, whatever, those are the kinds of things that we see in their evaluations, and we try to convey that to the students to help them be more prepared. But certainly it helps to have that communication and that connection. That's why it's really important, I think. Us as a school, we do a great job of building good relationships with these hospitals, to the point where you can text the preceptor, or I can text the preceptor and ask for a meeting or ask for a little bit of time, a Zoom session, just to see how students are doing. And they're generally pretty good like that once they get to know us. And of course, a lot of that, again, depends on how well our students perform. And generally, we have very good students, and we're proud of that. And that's what makes this all work.
Okay. Awesome. So again, having the unique perspective of dealing with day-to-day preceptors as well as upper management in the hospitals, you're pretty much the first person that a preceptor or even the hospital management will get in touch if things are not going well. Does that happen often?
Not often, but like any relationship, there's going to be pitfalls, or there's going to be some issues that come up. I try to be that person, like you said, the first point of contact, but at the same time, do it in a way where they're not dreading having to reach out to me or having to not want to, hear from me or see my text message or see my phone call. Try to do it in a way where, we take an open approach in terms of, just an open door approach with them if they ever need anything, that kind of stuff. And so generally when there are those issues, they're really good about communicating with us, whatever the problem might be. It could be that a student needs more help. It could be that maybe we need to provide more service to the hospital to expand whatever their educational needs are, or their educational office needs are. Most of the hospitals we work with have pretty strong medical education units or departments or GMEs, and so that really makes it easy to work with, to have our students working at those sites. But there's always room to advance that, to expand on that, and that's why schools like us, having our students in hospitals across the various sites that we have really makes for good collaboration. And, having that communication with the CMO or the DIO really allows us to take advantage of those opportunities where maybe we can fill in gaps, as a school. And so, yeah.
So obviously, as you said, it doesn't happen often, but it seems like it does happen where things kind of go awry. So would you say that there are certain students who are unsuccessful in clinical rotations?
Overall, no. I would say more students, and at the end of the day, we're really good about getting them to accomplish their goals.
Okay.
However, there are times where students might come up short in a particular area, maybe at a particular rotation.
Okay.
They might have a bad day or a bad week. That happens. It has happened. And that's where, our administration, including our clinical deans, our clinical services staff, we're generally really good about counseling, bringing in the student, addressing the issue, figuring out the best way to work around it and move forward. Very, very rarely do we see a student just not able to continue forward. Very rarely. It has happened, but I think at the end of the day, we try to exhaust every possibility that we can before we take those drastic measures to, ultimately, stop a student from moving forward.
Okay. So if I were to frame a question, what makes a clinical student successful? So let's start with what makes a clinical student successful. Then I'd like your take on what makes a clinical student unsuccessful. Because as you said, it's happened in rare cases, and what students should not do. So first, let's start with, what do you think makes a clinical student successful?
In my experience, a great student who has done well in our program is someone who's proactive, takes initiative, takes leadership roles, doesn't shy away from the opportunity to get their hands dirty, so to speak. This is a tough field. And I've only seen it secondhand. I don't know firsthand what it takes to become a doctor, but seeing so many students that we've worked with, the ones that are more successful tend to not be afraid to fail. You're going to have you're going to make mistakes. There's no question. The preceptors want you to trip up so that you can learn from that and get better. They want you to have that experience. And so the students who are less reserved and are more inclined to get in there generally do well. The ones that stand in the doorway in the back of the room when they're examining patients, those are the ones that tend to struggle a little bit more.
So help me unpack that a little bit. You said leadership roles. How can a student show leadership in a rotation when it's essentially like 5 students standing there kind of trying to absorb what the preceptor is saying? How can they possibly show leadership?
Well, a lot of it comes from one, confidence. I think, the students who have the confidence to corral other peers, organize peers, even if it's something on the administrative level, like schedule organization. Maybe a student leader will organize 2 students to follow the doctor in each patient room to make it so that they get more out of that experience. It could be creating a research project, right? And involving others so that whatever they're being exposed to in a rotation, maybe they can extrapolate that and put it into a paper or something like that and organize the team around that. Also, it's a lot of it's communication. 100%. No matter whether you are fit to be a leader or not, if you want to be successful, I think communication is key. Whether it's with your preceptors, with your peers, other people in the team, like the nurses, the medical assistants, et cetera. And of course, with the school, you have to have strong communication skills.
So it almost seems like these students, the ones in leadership roles, take a very proactive approach to make the lives of their preceptors easier. Is that a fair way of putting it?
I think that's what they strive for. Is to facilitate the roles that maybe the preceptor doesn't have time to do,
I see.
Or maybe just isn't inclined to do. But it's about not only considering what they can do for the preceptor, but what they can do to help others, right? I think a big part of being a student is the ability to lean on each other, and that's what makes our students in particular so strong, is that there's a very tight-knit bond between them, whether it's student government association or whether it's these focus groups that students get involved with. There's just this tight relationship that allows them to help each other through those experiences. And again, not only make it easier for the preceptors that they work with, but for each other.
So at the end of, say, a rotation or something like that, have you ever heard compliments about a student? Has a preceptor called you and it's like, wow, this guy or this girl was amazing. Mm-hmm. Please send me more students like this. Have you ever heard that?
Oh, all the time.
Oh, really?
All the time.
Okay.
Especially when we go in person to do our site visits. Right. Doctors generally will know the students by name even after they leave rotation. They'll say, hey, the student still keeps in contact with me. Okay. They were amazing. They're still doing research with me even though they're not in rotation anymore. So doctors, if you make a good impression on them, they will absolutely get to know you. You have doctors who invite students out for events, out for meals, out for networking opportunities, conferences. It's not uncommon for doctors to have strong relationships with students.
Right. So I remember I'd gone to a hospital with you once, and the preceptor came and told us about one of these students, and this really stuck with me. And obviously this impressed the preceptor tremendously. And if you could give an example something like that that you remember, that would be great too. But I remember this particular student, the preceptor categorically came up to us or to you and said, hey, you know what? I want to talk to you about this student. And we were like, uh-oh, here we go again. This is probably not a good thing. And he's like, no, this is great because I've never seen this in a student, where a patient came in. She was a young mother in the ER, and she had a little child at home, and the babysitter was gone, and she needed to rush. And I think in her haste, she got into some sort of an accident and she was injured. The student calmed her down, administered the care that she needed, and then apparently drove over to ensure that that particular child is taken care of, and then brought the kid back because the mother was obviously not that serious, and brought the child back to the mom. And the preceptor was so impressed by something like that. And he said, I always knew that this was a fantastic student, but the fact that she showed so much of heart is just at another level. And I was like, wow, I mean, that is something that I typically probably wouldn't have even thought of, but this particular student did that. Are there any other such examples that you can remember?
Absolutely. That's what makes this particular job role that we have as administrators of St. James so rewarding, is that we hear stories, for example, of students going beyond the call of duty. It's not just performing patient care, it's just being a human. I had a preceptor recently tell me that both of his parents passed away roughly around the same time. And so, that's a very tough situation for anybody to have a loss like that. But this particular doctor was going through it emotionally and just still working. A lot of weight was on them to keep working at the hospital that they were a part of. But the students who were rotating with him were very compassionate. He specifically mentioned the two students by name and said what they did in terms of helping him through this time of sadness and the loss that he had gone through in such a short period of time. And he remarked at how they really stepped up, not just in the unit that they were working in, but on a personal level. They checked in on him. Hey, doc, do you need anything? Is there anything we can do on his day off? They were, constantly checking on him. And it was just, that, and this was a short period of time. The students are not necessarily there a long time, but in that short opportunity, the students really have a unique opportunity to make an impact, not just on the patients, but with the people that they work with. And, those things carry on. Those things carry forward.
Wow, that's beautiful. I mean, I'd go out on a limb and say that that's St. James students only. But so now switching gears, what makes a student unsuccessful? Can you tell us some stories where I'm sure you've heard stories or preceptors have called and been like, please, never again a student like this. Can you give us some examples of that?
Well, in the rare occasions when it's happened, we've had students who sometimes, in one particular case, was just not prepared for that rotation, didn't do their due diligence. And, we understand that, there's so many different aspects of medicine and not everything is going to appeal to a student. But you have to make that effort, especially, in these core rotations. Those are all mandatory. And, sometimes students will feel like, well, this isn't, this particular specialty isn't of my cup of tea. Mm-hmm. So in their mind, they might think, well, I don't have to prepare for it. I don't have to take as much time or dedicate as much time. And the preceptors pick up on that. The team that works around the preceptors, like the staff, they will pick up on that. And when you show a lack of interest or, engagement, that's going to be noticed. And in one particular case, I know our clerkship director, Dr. Irizarry, approached the student and said, hey, I'm going to give you some remediation. I want you to work on this. And unfortunately, the student still didn't succeed because they didn't adhere to the remediation that the doctor gave them. So, those are the kinds of things that rarely happen, but can certainly, it's sort of a trap that students can easily fall into when they don't have a particular enthusiasm for a specialty.
I got you. So, but what do you think a student can do if they want to get into surgery, and they're doing a OB rotation, and they're like, you know what, I don't need to do this. Well, what do you think your suggestion would be to those students? I mean, given that OB is only like a 6-week rotation.
Yeah. I mean, for me, having worked with our deans who are more the experts on how to tie all these different specialties together, I can tell you that in general, it's just best to approach each opportunity as a way to advance yourself, to make you a better physician. Even though you're not going to be an obstetric gynecology doctor, okay, you might be a family medicine practitioner, or maybe you'll be a hospitalist. At the end of the day, it's making you a better doctor overall. So take advantage, approach it with the same eagerness, the same dedication that you would the specialty that you're more passionate about. Because these are, again, short rotations. You're there only for a short period of time. I don't want to say suck it up, but I think we all have it in us to make a better effort, even for a short while, right, at something that maybe we're not as enthusiastic about.
So, Joe, this thought just crossed my mind. And I don't know how valuable this is. You probably have a better view of this, but if a student wants to get into general surgery, does a letter of recommendation from an OB physician mean anything at that point?
Absolutely.
Really?
That's why it's really important to have good relationships with everybody you encounter. Every preceptor that you work with is a potential LOR writer. And a lot of programs, a lot of residency programs want to see a well-rounded individual, not just someone who's one-track minded. You might be fantastic at surgery, but they also want to know that you can bring more to the table. Maybe you have a skill set that will allow you to work well with other practitioners, other specialists. And that's, I think, the great thing about medicine is that it's team orientated, right? You're always working with other people, other specialists, other individuals with different sets of skills. And you got to bring it all together for the sake of improving healthcare for an individual or for your patients. And so you want to bring that, I think, to your residency application.
I see.
Whether it's, multiple LORs from different specialty groups, or if it's a personal statement that describes, your interest in other areas and how it ties to your ultimate passion of surgery or whatever the case may be.
Okay. So just generally speaking, I've heard of something called an MSPE, which also kind of leads to why you need to do really well in all rotations. I mean, and we really want to talk about this at a later date in a lot of detail, but I get a lot of questions from students. Hey, what's an MSP, especially when I go to meet students in basic sciences? Could you just briefly tell us what the concept of an MSP is?
Yeah, the Medical Student Performance Evaluation, formerly known as the Dean's Letter, a lot of places might still refer to it as the Dean's Letter, is really a summation of your clinical performance. Okay. It does include some overall characteristics or attributes of your medical school performance, but it really focuses on what you did in rotations. So that's why, again, it's really important to put your best effort in all of the rotations that you do, regardless of what you decide to apply to, because you want that to show, to really become evident to the programs you're applying to, that your performance was, above average, that you were outstanding as a student in all areas. A lot of the feedback that your preceptors give us on your evaluations will show up in the MSPE.
I see.
And then, of course, the deans, the clinical deans of St. James will write some feedback. Generally, it's not the biggest portion of the MSP, but it does get added on there. And so you want to be professional. You don't want to have any complaints on your record. We've had, those rare instances where students have had shortcomings and have had issues in rotations. And unfortunately, those kinds of things get documented in your MSPE.
I see.
So you definitely want to stay away from having those incidents, whether it's with other students or especially with preceptors. You want to just make sure that your record stays clean, because at the end of the day, we have an obligation to report that. Yes. We want to make sure that programs know what they're getting when they're interviewing our caliber student. And so, we want to do the best we can to depict that accurately. Right.
Wow, it sounds like a report card for clinicals.
Basically.
Oh, yeah. Wow. Okay. So I'm going to get a lot of hate for this from the young people, but have you heard any stories about entitlement for any of our students coming in to the clinicals, or any preceptor complaining about it? Or maybe they don't use the term, but your interpretation was this might have been a situation of entitlement.
That does happen. It does happen. But I'll tell you what we hear mostly is that the entitlement or that attitude generally comes from American students.
Really?
More so than our Caribbean students, right, or international students. And that's why I think a lot of the times our students are more endeared, compared to the American students that they work with in some rotations, because of the fact that they work hard to earn what they get. Whereas, sometimes if you went to an American school, or if you're going to an American school, you feel like it should just be given to you.
Okay.
But every once in a while, our students will exhibit that type of behavior or disposition. And sometimes with a little bit of correction, they generally, reel it in and okay, take a better approach. And I think a lot of it comes from the experience of being in rotation.
I see.
When you're not in rotation, like for example, students who are in basic sciences still or prepping for clinicals, they might have that sense of entitlement for whatever their background is or whatever their their mentality is at that time. But once they start working in rotations and they start working in the hospitals and they see the kind of patients they're helping, it generally changes and shifts to a more let's say a less entitled attitude. Right. So it does improve, and I think overall our students exhibit a really good demeanor and disposition that most preceptors speak highly of.
Okay. Do you know any specific examples what you would consider to be entitlement from students?
Well, I think that working at hospitals in certain areas, I think that could be a little tough for some students to adapt to. And so if we have rotations in a particular area, especially like in Chicago, where it's a very eclectic town, there's really great parts of it and then there's not so great parts of it. But at the end of the day, our mission is to expose the students to as much types of cases as they can learn from. And so you might have students from time to time complain about where certain rotations are, the fact that they have to go to some of these not so nice neighborhoods that are in certain areas. But I think that attitude quickly changes once they see the impact that they're having and how they can really help people in a positive way.
Awesome. So, Joe, this is very, very valuable insight. You did mention one thing, and I, just want to try to understand in how many rotations are our students shoulder to shoulder with American students?
I mean, I can't give you an exact percentage, but I would say, a pretty good chunk of the rotations, not just in Chicago, but even in Texas and West Virginia, there is a good percentage of American students, either from MD, allopathic schools, or osteopathic schools that are working alongside our students.
Right. So you mean to say that students in our school who've paid literally half of what an American student has paid, they're doing the exact same clinical rotations?
Oh, yeah.
Wow.
And not just with other American students, but residents. In some cases, they're working with residents who went to American schools.
Wow.
So our students get a lot of bang for their buck, but again, a lot of it depends on what they put into it. They'll get out what they put into the experience.
Wow, awesome. So, thank you so much for the insight. But before we leave, if you wouldn't mind, in your views, especially since we actually talked about this, what do you think are, say, some qualities that make a successful student, and what do you think are some qualities that make an unsuccessful student? Just to summarize and close out the conversation.
To be successful, again, it's communication, having strong communication skills with everyone around you. I think you also have to be proactive, always look for the opportunity to take initiative, and that'll help you stand out a lot of the times. And then I would say also, to be successful, you really have to be put your best foot forward in every opportunity that you get, no matter what the interest or the level of interest is. Make the most out of it. It's going to make you a better physician. It's going to make you a better person.
Right.
So just those three things I would say are at the top of my list. And, on the other side, if you're not successful, you're going to be someone who tends to take things lightly. In other words, take it for granted, the opportunity that you have to help others and to be a part of a healthcare team that is providing a service that most of us don't even understand, to be honest. But, when you see that and you sort of take it lightly, or you tend to blow it off, in one of the cases that we talked about earlier, where you don't adhere to the remediation that you're receiving from either the school or the preceptor. If you don't listen to that advice, you're going to fail. You're going to succumb to the pitfall.
Right. I mean, I think that is some form of entitlement. If somebody who decidedly knows better than you tells you to do something, and you're like, yeah, no, I'm just not going to do it. I think that is some sort of entitlement. But anyway, I mean, I don't want to keep harping on that because that seems to be a watchword of Gen, what is it, Y or something? But anyway, I'm dating myself a little bit here. But thank you so much for your time, Joe. And I know you're extremely busy. And I know one of the major initiatives that you've taken in the last couple of months has been actually starting student government associations in each one of our sites. Is that right?
Correct.
Do you want to talk a little bit about that before we leave?
Yeah, and that's a good way to get involved. I think that's also key to a successful student is just, being involved. Student Government Association is key for us because it helps us attain more feedback about what's happening in clinicals. And it also helps us provide a better service to the students and improve in areas that maybe we didn't think of. Just getting involved in organizations like that. I think I mentioned focus groups earlier, but the SJA is something that's relatively new for clinicals. We've had it in basic sciences for many years, but this is a relatively new opportunity that we started at the end of last year, and it's been going great. The students are very engaged. The ones that are managing the local chapters are starting to come together and form a relationship across the different sites. So that is helping us be a little bit more integrated, across all sites. And for us to be a part of that, to hear their feedback and to be able to contribute to making their experiences better has been tremendous.
Wow, that's awesome. I mean, Joe, hats off to you. I know the clinical students are actually a subsection of our students that are the happiest from whatever we've seen from the student.
Yeah, kudos to the deans as well. The deans are very involved with that. And of course, our administration as a whole has been very enthusiastic about helping students. Right. I think it's a collective effort. We've all done, great things to work together and help the students.
Right.
So.
Awesome. Well, again, thank you so much for your time. And thank you for giving us some words of wisdom and kind of demystifying the clinical rotation process for us a little bit. Thank you so much.
Enjoyed it, Kaushik. No problem.
Thank you so much, Mr. Torres, for your time. I know you're very busy, and I think you just had to jump off for another SGA meeting. And I know that you were instrumental, and you're constantly advocating for better experiences for the student. And you've actually worked really hard to shape the relationships that we maintain with our hospitals. But again, thank you so much. And again, as I mentioned, thank you so much for demystifying this particular role. I know a lot of students, especially in the basic sciences, keep asking me what the clinicals are like. So I hope this sheds a little bit of light without getting into too much technicalities. And do let us know if this was helpful. And in the meantime, give us a follow and give us a like and download our podcasts on all the major platforms such as Spotify, Apple, and YouTube. And do let us know what you think in the comments. And remember, there is no shortcut to becoming an MD.
Thank you so much for tuning into our show. We hope you enjoyed another episode of Med School Minutes. If you like our content, please follow us and receive notification when a new show is posted. This podcast is brought to you by St. James School of Medicine. For a video version of this podcast, please check us out on sjsm.org/video.